For decades, planning your retirement healthcare meant walking a clearly divided path. You could pay higher monthly premiums to buy absolute freedom and see any doctor you wanted, or you could take a zero premium plan and accept strict networks in return. But heading into 2026, the noise has reached a fever pitch. Aggressive sales tactics are now pushing a narrative that original Medicare has changed the rules, claiming you now need a permission slip from an insurance company just to get the care you and your doctor agree on. This table maps Medigap's actual promise against the 2026 rumors. We're seeing massive fear about prior authorization, alongside the real danger of wildly fluctuating premiums based on where you live. This prior authorization scare stems from a government pilot called WISeR, but it's completely misunderstood. We are going to strip away the marketing hype and the 30-second commercials. Instead, we'll look straight at the only two variables that actually dictate your healthcare access and your monthly costs this year. Securing your retirement means ignoring the national rumors entirely and focusing instead on hyper-local math. First, let's address the WISeR pilot. It stands for Wasteful and Inappropriate Service Reduction. It is simply a test program that requires doctor pre-approval for a highly specific, short list of non-emergency outpatient procedures. This U.S. heat map maps out exactly where this pilot operates. Right now, it is only running in 6 states: New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington. For the rest of the map, the 44 states are entirely untouched. Your healthcare access hasn't changed at all. Even within those 6 states, watch how this funnel narrows the scope. WISeR only impacts about 10 specific treatments, like certain nerve stimulators or knee scopes. It explicitly excludes emergencies, and it does not touch hospital inpatient stays. Contrast that hyper-narrow test with Medicare Advantage plans, which use prior authorization systems across a huge range of your everyday care, nationwide every single day. And remember, WISeR is an original Medicare program. If you have a Medigap plan, also known as a Medicare supplement, your insurance carrier still adds 0 prior authorizations and 0 networks. Switching to a Medicare Advantage plan out of fear of WISeR means voluntarily trading a tiny, specialized pilot for systemic, everyday insurance gatekeeping. The actual financial danger to your retirement doesn't come from a pilot program. It happens the moment you drive across a state border. 2 people can buy the exact same Medigap Plan G coverage with identical benefits and pay drastically different amounts based purely on their zip code. This cost comparison bar chart shows exactly how dramatic this split is. A standard Plan G policy might cost you $117 a month in one state, while the identical coverage costs over $500 a month in a state like New York. Those price differences have absolutely nothing to do with coverage quality or health networks. They are driven entirely by invisible state pricing laws that dictate how insurance companies are allowed to charge you. Your Medigap medical coverage is completely portable and travels with you across the country, but the pricing laws that make that coverage affordable are strictly trapped inside your state borders. This line graph tracks a pricing model called attained age. Under this law, your initial premium starts very low at age 65, but it automatically increases every single year as you get older, regardless of your health. Now look at these 2 new lines representing issue age and community-rated models. The baseline rates start higher, but they stay relatively flat because they do not increase strictly based on you having another birthday. The danger of an attained age policy is that the compounding yearly increases can eventually price a perfectly healthy 80-year-old entirely out of their coverage. If you are trapped in a high-cost state, you have a strategic lever you can pull to fight back: downgrading from Medigap Plan G down to Plan N. Plan N cuts your fixed monthly premiums significantly. The trade-off is simply accepting small copays when you visit the doctor or go to the emergency room. Understanding these state pricing mechanics gives you a direct way to lower your monthly costs without sacrificing your nationwide network of doctors. This decision tree flowchart isolates your first real choice. Do you prioritize absolute budget predictability, or do you prioritize healthcare autonomy? If you want absolute access to any doctor and you hate networks, follow the path on the right. You should stick with original Medicare and a Medigap plan and completely ignore the noise about the WISeR pilot. For the pragmatists who live in expensive pricing states, pull the Plan N lever. It allows you to maintain your doctor freedom while cutting your fixed monthly costs to a manageable level. If you are strictly budget constrained and your state's Medigap premiums are simply financially untenable, Medicare Advantage is a valid alternative, as long as you clearly understand the strict network trade-offs you are accepting. Because pricing laws and healthcare access are hyper-local, a generic 30-second television commercial can never accurately dictate your personal strategy. You need an independent specialist to look at the exact pricing laws in your specific zip code. My name is Darren Whitehour with Ecos Medicare Solutions, and I model these scenarios for people every single day. The ultimate, stress-free Medicare decision doesn't come from national fear-mongering. It comes from trusting personalized, geographic math. Reach out and let's map your exact numbers.